this happened, and I was glad to see it. The Mission Act is back front and center at the VA. We're actually doing community care. We're actually giving the veteran the choice that they've earned and they've deserved, whether they can get their VA care inside our facilities or in the community. It's their choice. It's VA care. We're going to give them the highest quality care wherever they want to go. Also, we're expanding out options for treatments and others for those that are new. We're experimenting and looking at new counseling ideas, all new drug techniques that we can help with PTSD, TBI, the things that are affecting our veterans right now. But also, we've taken the leadership to take people and bring them back into work where they're actually communicating. They're back in our offices. We put thousands of people back in. We're processing more claims daily than we were in the last little bit, hit 1 million before has ever happened, and we're actually bringing it down. And I've actually taken our deputy secretary, and he is actually having a strike force now to bring down that disability claim, plus our regular work that we're having done. We've also taken almost $300+ million and taken it out of contracts that we've all heard about so far. We were doing contracts for meeting notes and PowerPoints. And if our folks didn't know how to do meeting notes and PowerPoints, go online and learn yourself. We're not going to pay for it anymore. And we took $360 million and put it back into community care and also our health records management system that we have. We've opened 6 new facilities just in the last little bit so all the media who wants to talk about how we're hurting healthcare, we just opened 6 new facilities. By the way, thank you, you're welcome. As we go from that we've continued. We've also took $11.6 billion in ceiling values of contracts and terminated that we did not need, resulting in significant cost avoidance for the future, but also still maintaining the ability to take care of our patients and also our disability benefits. We've also gotten unity again. We did away with $14 million in DEI spending. We've ended gender dysphoria treatments. We phased that out. All directed the savings from that go to paralyzed veterans and amputees. We've also continued to work toward, as you've, in anti-Semitism and also anti-Christian bias that we saw. The biggest thing though, Mr. President, I want to state, is you told me when you said for me to take this job, you said take care of my veterans. Well, we've done something in taking that step forward. The veteran is back first at the VA. The VA is not about itself anymore. We're not a self-feeding animal. It's about a service organization that takes care of one of the best that we have, and that's our veterans. And that one, Mr. President, we're just getting started.
Thank you, Doug. How are you doing with the suicide rates?
We're getting, it's tough, Mr. President. That's something that we're looking at. This is something that we've had $588 million has been spent over the last 4 or 5 years to be prevention, and yet the numbers stayed at 17 or 21, wherever you're going to have it. We're now opening that back up, taking in nonprofits. We're bringing in others who have things that are actually looking at. I've worked with Secretary Kennedy and others on the idea of we're opening up the possibility of psychedelic treatment and others that give us an opportunity. We got to research it, make sure it's good, but it's opening up that possibility. And I think, again, veterans are understanding now that we're putting them first. When I go to these hospitals, they're actually coming up saying thanks. We're back in where we need to be, and we're seeing a workforce development. So suicide is going to come down. It's also going to take some transition stuff that your Secretary of Defense has been very helpful on. We've got to transfer them out of the military so they come to us better, but we're working on that.
Thank you. Jamison?
Mr. President, it may come